Ever wondered if losing a few pounds could actually make you look a little more impressive in the mirror? You're not imagining it. For many men, weight loss can make the penis appear longer. But is it magic? Surgery? No. Simple anatomy and physics at play. Let's break it down. First, an important fact. Weight loss doesn't actually make your penis grow. The visible change happens because of something called the fat pad, a layer of tissue right above the base of the penis. When this area has extra fat, part of the shaft is buried under it. Think of it like a fence buried in snow. The pole is the same height, but more of it is hidden. When the snow melts, more pole is visible. According to urologists from the American Urological Association, every 10 to 15 pounds of weight loss around the abdomen can reveal up to about 1 centimeter of visible length, though results vary from person to person. While the cosmetic change is interesting, the health benefits of losing weight are far more important. Better blood flow. Obesity can impair circulation, and good blood flow is essential for erectile function. Hormone balance. Excess body fat can lower testosterone, affecting libido and energy. Reduced risk. Being overweight raises risks for diabetes, heart disease, and high blood pressure, all of which can contribute to erectile dysfunction. The Mayo Clinic and NHS both emphasize that maintaining a healthy weight improves not only physical function but also sexual health and confidence. Imagine two identical twins. One weighs 170 pounds, the other 240. Their anatomy is identical, but the heavier twin has a thicker fat pad above the pubic bone, making his penis look shorter. If he loses 40 to 50 pounds, more of the shaft becomes visible without any change in actual length. Same hardware, just a clearer display. A study published in the Journal of Urology found that men who lost significant abdominal fat reported not just an increase in visible length, but also improved sexual satisfaction. The improvements were tied to better self-image and increased physical stamina. Crash diets aren't the answer. Instead, aim for slow, steady loss, 1 to 2 pounds per week. Focus on whole foods. Lean proteins, vegetables, whole grains, and healthy fats. Stay active. Cardio for heart health, strength training for muscle tone. Monitor waist size. Men should aim for less than 40 inches to reduce metabolic risk. If you're concerned about your weight, energy, or sexual health, talk to your doctor early. They can help check for hormonal imbalances, circulation issues, or other underlying causes, many of which are treatable. Your body is more adaptable than you think. Even modest weight loss can boost confidence, improve sexual function, and reveal a little more of what nature gave you. And remember, this is about more than inches. It's about living longer, feeling stronger, and enjoying life to the fullest.